Welcome everybody to the Cribs for Kids Safe Sleep Champion webinar series. For those joining us live, as you log in, you'll see your mic is muted, your camera is off. So go ahead and enjoy the lunch, snack, or coffee wherever you are in the country that you're joining us from. Also, as we get started, you can see that chat and Q&A are available to talk with us and our Safe Sleep Champion guests. Chat is for comments to us and Q&A is for questions. If we don't have time for questions at the end of the hour, and oftentimes, honestly, we do not, we'll stay on and answer them via the Q&A feature, or if you can't stay on, we'll reach out using your registration contact. Team members Andrea Wilson and Kelly James are keeping an eye on both chat and Q&A for the hour. So let's get started. My name is Devin George. I'm the program officer here at Cribs for Kids, and I am so glad to be sitting here again and really happy to be joined by my colleague, Bridget Gossa, our operations officer. You may recall that Cribs for Kids held monthly Safe Sleep Champion webinars across 2023 to mark our 25th anniversary. Like today's sessions, those webinars were live, but recorded to be uploaded to our website and our YouTube channel, which you can see on the screen here. So that means you can watch and share any of our earlier episodes. And there are loads of them out there that are so great, and share them with other people. Today's episode will be uploaded in about a week, and you can do the same there. So our 25th anniversary Safe Sleep Champion webinars brought us nearly 1,000 attendees to our live sessions, and we're nearing 4,000 views on YouTube across the 12 episodes. You guys, thank you so much for engaging. We are so happy that you are finding those and enjoying them. And so with that kind of feedback, we are relaunching the Safe Sleep Champion webinar series, but holding it quarterly instead of monthly. And what better month to kick off the quarterly series than October for Infant Safe Sleep Month? We have a lot to talk about this hour with our Safe Sleep Champion guest, Ed Guidry, the Director of Director of the Bureau of Child Fatality Review and Prevention for New York State, and Courtney Griffin, the Director of Consumer Product Safety for the Consumer Federation of America. But before they join us, we have a few things to talk about ourselves. October's Clear the Crib Challenge, the debut of a new online education resource, and some new infant safe sleep products. So first, the Clear the Crib Challenge for October. If you logged in right at the top of the hour, you saw a compilation video of some of last October's Infant Safe Sleep Month hashtag Clear the Crib challenges, and we are at it again. Clear the Crib Challenge is a nationwide program designed by the NACHD to promote infant safe sleep across the month of October. Clear the Crib is designed to gamify safe sleep education, as you see people pulling those things out with the timer on, while making it shareable across social media. And why? Well, knowing babies born to young parents have a disproportionate number of sleep-related deaths, the NICHD wanted to focus Safe Sleep Month efforts on reaching this group, and that means social media. Cribs for Kids will be sharing challenge videos all month long on our social media, and we hope you'll join in, either posting on your own social media, sharing your videos with us, or sharing our videos on your page. See that nice big circle of support there, and all, of course, with the hashtag Clear the Crib. The NICHD has all the information that you need on their website that you can see here, and it includes a toolkit. So Cribs for Kids is going to share our videos from events that we've been attending, like the City Match Conference. We're going to the Safe Kids Worldwide Safe Sleep Summit later on, and the APHA conferences, and we'll be doing Clear the Cribs with folks there. Locally, our Clear the Crib team is visiting Safe Sleep certified hospitals across Pittsburgh, where we're headquartered, setting up the challenge in those hospital lobbies. So follow us on social media to see them, and be sure and tag and share your videos. Okay, Clear the Crib, that's one. Two, we are so excited to debut a new free education resource via this webinar. It's our new Safe or Not Safe photo module. You can see it here on the screen, pieces of it, it flips through. We are so happy to release this new education tool, also in support of October's Infant Safe Sleep Month. Like our Safe Sleep Ambassador, which we hope you all have taken, and if not, go ahead and head to our website to do that. The Safe or Not Safe photo module is a free online educational resource anyone can use, and it was super collaborative. It started with our Safe Sleep Champion and Program Advisory Board member, Lori Winkler. She uses photos at the end of her presentations to evaluate learning. And I attended one and saw that the people in the audience were so engaged with that part of it. we thought, well, maybe there's value in expanding upon it and making a standalone photo module for education. It got a great start this summer, thanks to Jackie Brick, who was our intern from the University of Pittsburgh Public Health CDC program. She worked with us to build the foundation of the module, and she won recognition from her program for her good work. Then we took that and invited members of our new program advisory board to provide feedback. It was a great way to launch their work as a team too, and you'll hear more about them in our 2025 first webinar. The module, as you see here, is simple but impactful. There are 26 photos. Users are asked to choose if the baby in the photo is safe or not safe. Clicking their answer, they are told if they're correct or not correct, and with explanations outlining why or why not. See, simple, right? This new image-based module can be used by individuals or in a group setting. It can assess knowledge before training, evaluate learning after training, or refresh your own learning, or just generate a conversation in a group setting. Let me tell you how you get there. So to access the safe or not safe photo module, that's a different one. Photo module, you go to our website, cribsforkids.org, then click on the programs menu option, and you'll find the link right there. When you click the link, we ask you to provide some information about who you are and how you're using it. Again, super simple. The safe or not safe photo module will be an evergreen education tool, allowing for nearly immediate updates if evidence or product information requires. So when you start the module, you'll see the date in the lower right-hand corner of the title page. So maybe if you're using it to teach 1 week and there's some new product information that comes out, we might put a photo in there for that. And when you use it the next week, you're like, hey, what's that one? So be sure to check that date. Right now, it's available in English, but like all of our education, it'll soon be available in Spanish. So next, our new products. You may have heard us say that Cribs for Kids funds our free programs and education through the sale of our Safe Sleep products to our partners and supporters. Maybe you've heard us say that, I think, probably, right? So on the heels of our new Safe or Not Safe photo module for October, we have some new products to share. So Bridget, let's talk about these. They are all great, but I have a favorite one that we're saving for last. Okay, so thanks for joining to talk about all that's fun and new. Just since our conference, right? We had our national conference in May, and all of this is new since then.
Yes, yeah, I'm so excited to be here and to talk about these new products because we do have so many new ones. And just since May.
Yeah. Okay, so first, before we get started, let me tell you before we get started telling you what we have, let me tell you how to order and see what's there. So our online product catalog you can see on the screen. To get there, just like the modules you go to our website, but here you're going to click on the partner menu item. And under that, you'll find the partner catalog link. Just click through and start flipping through the catalog. And right below the catalog, you'll find the pricing list that's organized by SKU numbers. Then when you're ready to place an order, this is watch our high-tech handover. Woo!
Yeah, once you, if you find an item that you'd like to order, you can we make the process absolutely simple. Our partners can go to the upper right-hand corner there of the website to that store button. Just simply press on that store button and you can order at any time. And you can make any order that you'd like. And then our orders are typically processed and fulfilled within just a few days. So we try to keep everything super simple and quick. If anyone is interested in becoming a partner, because any nonprofit can become a partner, the process there too is very simple. You just actually can go to the partner tab there on the website and scroll down to become a partner and fill out the application. Once again, it's a simple process. And of course, if you need a quote before you place an order, our logistics team is here to help with that. And for anyone that is interested in possibly placing an order and is not eligible to become a partner because maybe you're not a nonprofit, or if you'd just like to order personally, you can do that through our public e-commerce site, etc. And of course, the purchase of any items from etc. also support Cribs for Kids free programming. One more thing, Cribs for Kids has expanded our warehousing and distribution capabilities beyond our warehouse here in Pittsburgh, where we're headquartered. We now have distribution centers in California, New York, and Indianapolis. And what this means is reduced shipping costs and wait times for your products. So if you haven't ordered or requested a quote recently, we hope that you'll give us consideration.
I hope so too, especially with all the new products that our Cribs for Kids partners and et cetera shoppers will have access to now.
Yeah, we've really expanded beyond safe sleep products to offer everyday items for baby and parents. So on some of the existing products, we have new patterns, including our hearts and this adorable Babette, the whale print, just so adorable. I love him. We also have items available to support breastfeeding. We know that reduces the SIDS risk. So we have items like the nursing cover showed here in the slides, and then burp cloths, also bottles, and then a nursing support bag, which includes reusable storage bottles and ice packs. We also offer breast pumps, which you won't see in our catalog, but you can contact us for inventory and pricing. We also have this new snack and sippy cup, which is absolutely one of my favorite new products that we have. And then we also have a really nice high quality diaper bag. We try to offer, what we say is we offer high quality products at low nonprofit pricing.
Mm-hmm. So you can head to our Cribs for Kids or et cetera site to see everything we have to offer, including new versions of earlier products that you might all be familiar with, right?
Yes, exactly. I'll show you some of those. So we have our healthcare kit and our grooming kit. So lots of new products. Our new patterns, like we mentioned, the Babette whale and our heart prints on our bib set and towel set. And then, of course, our new Snugget carrier. And then our new prints on the 5-piece and 7-piece snapette kits. And then we also have the long sleeve snoozette. And of course, we also have our snoozette wearable blanket and a budget-friendly wearable blanket as well.
Yeah, it is good stuff. And my favorite, I wish we had a drum because I would do a roll here. I love it because we are meeting a request that we've had from partners. And I know you and Judy worked so hard to make this available.
Yes.
Are you ready? It is
Yes.
our new.
It is the mini cribette. So this is priced the same as the cribette, and the mini cribette has the same great safe sleep message design. It also has all of the same great features, and it can be used for babies up to 30 pounds and 35 inches. It also has the bassinet feature for babies up to 15 pounds. And I mean, of course, it's portable. And also, of course, it is safe, very safe, meeting all of the ASTM, the JPMA, and the CPSC standards. The only difference is that it is 20% smaller.
Right? 20%. I love it so much. It's the small footprint that we've had so many partners request. And I think we have another slide that maybe gives some of those.
I'm sorry.
Yeah.
Thank you.
Yeah, whatever. It's a lot going on here. So we want to just kind of give you an idea of how wide and deep it is compared to our original cribette.
Yeah. So compared to the full size, the original cribette, it is the same height, but it is 4 inches narrower and then 7 inches shorter in length. And just to give you a visual, because you can always say 4 inches and 7 inches, but to really get that.
And 20%, I said I'd like to be 20% smaller. So we have practiced this to no avail. So, but this will give you an idea as we turn it, right?
So
you
much
can
smaller
see.
it really is.
Is that my side that needs popped up? So there you can see. I mean, that makes a big difference, right?
Yes.
At 20%.
Yeah, it really does. And so where for those small spaces, where space is a premium, this will make a big difference for that family, giving them the safe place for the baby to sleep, but also that space that they need to live. So it makes a big difference for those babies, caring for them where space is at a premium, from those really tight city apartments to the rural trailers. And I mean, this is really great for travel too. So the first shipment of mini cribettes is headed to the state of New York for a statewide program that they're launching.
And I know you and Ed are going to talk about that next, so I'll hurry up. The mini cribette is being manufactured and shipped as we speak. When it's available, we'll let partners know through our partner newsletter and our Safe Sleep Spotlight. And Safe Sleep Spotlight is the name of our newsletter, and social media. And so you can sign up for that for our newsletter by just sending an email to info@cribsforkids.org. That way, when it becomes available, or follow us on social media. You can see it works for Clear the Crib Challenge too. So you can see our Facebook, X, Instagram, YouTube, and LinkedIn channels here. So it's pretty simple, right? So now we're going to hear about New York and how they are using our products in education to support their goals.
Yes. Yeah.
All right.
All right. So we're going to bring Ed Guidry in here.
Yay,
Hey,
Ed.
Ed.
Hey, everybody.
Thank you for joining us. So
He has a, let's put Ed's picture up there.
Oh.
It's too
I am
many things
so
at
sorry.
once.
I'm in charge of the slides right now. I'm so sorry.
It's too many things at once.
All right, let me start by introducing you. Ed has spent his career advocating and protecting children and infants, working in child welfare and family services in New York for over 20 years. So he brings a lifetime of commitment and value-based work. Ed is the director of the Bureau of Child Fatality Review and Prevention for New York State. And he joins us to talk about the New York program to reduce infant mortality by preventing sleep-related deaths.
Well, thanks so much for having me today. I look forward to having a conversation.
Yeah, I'm so excited to talk to you. So, Ed, Governor Hochul has put forward some remarkable programs to support infant and maternal mortality, and the two being so intertwined. So, I'm sure you'd like to tell us about some of the first in the nation policies coming up in 2025.
Yeah, absolutely. In January of this year, Governor Hochul unveiled a 6-point plan to combat maternal and infant mortality in New York. This was in response to the recent CDC statistics showing an increase in infant mortality for the first time in over 2 decades. Support for this plan has already been incorporated into the budget for the 2025 fiscal year, and the plan covers these things here. We're going to be establishing paid leave for prenatal care appointments. There's new legislation to expand access to doula services. We'll be eliminating out-of-pocket medical costs for pregnancy-related benefits. We'll be reducing unnecessary C-sections through data monitoring and financial incentives. We'll be deploying new training and resources for maternal health through the 988 and Crisis Lifeline hotlines. And finally, why we're here today to talk about, we're going to be funding portable cribs for low-income families to reduce the risk of sudden infant death syndrome.
We're going to fully paid leave for prenatal care. That is amazing. Because we know that prenatal care leads to better outcomes for both the mom and baby. And it's clear that your governor, the first mother governor for your state, and her administration are leading the way in taking on these issues. You know, like doulas providing emotional and physical support for moms with new babies. You're all really giving a voice to families. So you must be so proud to be part of this work, preventing premature births and reducing that SUID risk. So tell us about the programs being put forward to reduce and prevent infant sleep and prevent SUID.
Yeah, of course. Infant unsafe sleep is the most common preventable type of death our agency reviews. And because of that, we do a lot of work to educate, raise awareness, and provide resources to families. Currently, our Bureau funds 22 local regional child fatality review teams that examine the deaths that take place in their jurisdiction and provide locally focused preventive measures to 36 counties across the state. We do a yearly crib distribution. Over the last 10 years, we've supplied 22,000 cribs to our partners to distribute in the field. And with this expanded crib distribution we're working on now, we hope to distribute that many cribs in the next year alone. On average, we distribute 6,500 safe sleep kits every year to our partners to support safe sleep education and outreach. We provide safe sleep education through our HERE's family line. That stands for Help, Empower, Advocate, Reassure, and Support. And through that line, we ship cribs overnight on an emergency basis to families in need. And we're currently wrapping up focus groups that were conducted in English and Spanish to better understand how to provide more effective safe sleep messaging. You know, we were already talking before about how to better utilize social media. So we're trying to do some research to really make sure we're doing that right. Our public information office uses social media to share safe sleep education resources and seasonal public service announcements to address other, child safety concerns. And finally, we do have a statewide child fatality review team. And with that team, we're looking to incorporate safe sleep messaging into various statewide processes to improve outcomes. Some of the things that have come out of that work is that we're now screening every call to our SCR, that's our child abuse hotline, for safe sleep, so that when the caseworkers are going out into the field, they can be prepared to educate families when they get there, and they'll know whether or not to have a crib or need to bring a crib with them. We've had all of our daycare licensors take the Cribs for Kids Safe Sleep Ambassador training so they can better support safe sleep practices in licensed childcare facilities. We're working with the Office of Temporary disability assistance to ensure every family getting public assistance is screened for safe sleep, provide education, and having a crib provided to them if they don't have one already.
So it's a very comprehensive plan. And the safe sleep training to people who work with families, plus safe sleep education with kits and products to those families. The big news is that the governor has committed to ensure every infant, every baby born in your state will have a safe place to sleep.
Yeah, it's really an ambitious goal, and it's a project that we're excited to be working on. That being said, the program is still under development. Historically, we've been providing cribs to our local departments of social services, local regional child fatality review teams, child advocacy centers. But now with this expanded crib initiative, we're looking to shift our focus to birthing hospitals. And through our partnership with the Department of Health, we know that hospitals are already providing safe sleep education and outreach, and in many cases, are safe sleep kits. So our thought is if we can start identifying families without resources to obtain a safe sleep surface when they're still in the hospital, then we can send them home with a crib when they're discharged and make sure those babies are sleeping safely on their first night home. If we can get all the birthing hospitals across the state to participate in this work, this is how we hope to really make sure our crib is available to every newborn in the state.
Oh yeah, this is such a great intersection between your state and Cribs for Kids, including our Safe Sleep Ambassador training. But it also sounds like our Infant Safe Sleep Hospital Certification Program aligns with the governor's plans too. I know that New York has 27, right, infant safe sleep certified hospitals, and with more applying.
Yeah, we
Yeah.
just did one this month, a new one. So yeah.
That's awesome. So, and I mean, the best news, this effort is to get a safe sleep space for every baby in the state, starting with their first sleep at home. And that's such a life-saving commitment, truly. So, and that's where our mini cribette comes in. So how will this benefit the at-risk families?
Well, we were excited to hear about the mini cribette when it was being developed, and since New York has such a really diverse population, we have obviously some large cities and we have some extremely rural areas as well. We really hope by having options for a full-size cribette and a mini cribette, we could better meet the needs of our families. Our thought is that making that mini cribette available will be a valuable resource for families living in like a small New York City apartment or a shelter or even a hotel room. So reducing that footprint by 20% really can make the difference between a crib fitting into a family's home or not.
Yeah, absolutely. So as an agency, we are so honored to collaborate on this first of its kind effort. So how are the staff preparing?
Well, since we already have a history of providing cribs to our child welfare partners, the transition there should be seamless. We're just going to be able to provide them additional cribs to support the great work they're already doing. I mean, we do know that we're not meeting the need, and the more cribs are definitely going to be welcome to support their work. Now, working with hospitals in this capacity, that's going to be new for us. Many of our hospitals are already making sure that families have a crib before infants are discharged. And if they don't have a crib, they are taking steps to get one for the family. But hopefully this work is going to support their current efforts and encourage other hospitals to really start that practice. But now, instead of calling the Here's line or going to an outside organization to find a crib, hopefully they can just go into their storage room and grab one.
This is wonderful, wonderful news.
Yep.
We'll keep you busy, Devin.
Right.
So improving safe sleep education and access to safe sleep spaces is absolutely invaluable. And you and your team do that work every day. And this is what we're learning. We're so happy to be working with you.
Well, I know that we really came here today to talk about how we can, improve education, outreach, and preventive work, but that's only half the work my bureau does. Our primary focus is on the review of child fatalities. And while that's hard work for anybody, it's especially hard for my staff to read every day about potentially preventable deaths that take place in unsafe sleep situations. Through our data collection and case review and our monitoring and oversight of the state's child welfare system, we really hope to see firsthand that this investment helps bring down the number of infants that die in unsafe sleep environments. And we really hope that if we can bring that number down, we can expand this program and hopefully it could be replicated in other states.
Yeah, absolutely. We hope so too. And it's why we do the work that we do each day as well. So Ed, thank you so much for joining us and choosing us as a partner in this program, and also committing to the mini cribette, and especially for your years of dedication to babies and families. Ed's going to stay on the line for the rest of the webinar in case we have questions on their work as we wrap up. Now, Devin, we know that sleep spaces need to be safe, and that's not always easy for parents to know what that means. So I guess you and Courtney are going to be talking about that next.
We are, yeah. Yeah, and again, thank you, Bridget and Ed. It is just, it's unbelievable to read about everything that New York State is doing. And maybe your state can't do everything, or your county can't do everything that Ed talked about, but maybe you can pull a couple of things that are manageable for your community, for your county, for your state. I mean, it's crazy to hear all the work that they've done with daycare centers, with child welfare workers, and we will have education debuting over 2025 for those groups of those professional groups that layers onto our Safe Sleep Ambassador. So that will support all of that and allowing you in your state or county or community to take advantage of those training for those targeted audience. But, you know, doing focus groups on how to improve safe sleep education, certainly we'll all benefit from that work that New York is doing.
Exactly.
So thank you so much. It is horrible, and it never gets any easier hearing about those babies we lose. So I hope you're all gratified and hopeful to learn about people that Ed and his team are doing to prevent those safe sleep deaths, and those global plans that the governor has. So we look forward to hearing more as the programs are implemented, as Ed says, being able to see that impact, and maybe we'll even get to hear from them in our October 2026 conference. That's what we hope for.
That's what we're hoping for.
Okay. So next up is Safe Sleep champion Courtney Griffin. Courtney is the Director of Consumer Product Safety for the Consumer Federation of America, where she advocates for product safety across regulatory agencies and in Congress. On behalf of people like you and me and all of us, Courtney collaborates with other advocates and stakeholders on consumer product safety. And she does all of this following a decade of litigation work on behalf of injured victims in complex product liability cases. Courtney's also a member of Cribs for Kids' new program advisory board, acting as our product safety expert. See how that fits? And Courtney, thank you so much for the work that you do and for joining us today. But before we start our infant product safety talk, and I do want to say, you know, when Ed is talking about their commitment to getting a safe sleep environment, families can go buy things, borrow things, be gifted things that may not be safe. So that's why we want to talk about how to identify those safe products. And to do that, I think we would all be well served to learn about the Consumer Federation of America, where Courtney works, and what that offers to each of us. So, hey, Courtney, hi.
Devin, thank you so much for having me today. I'm really honored and thrilled to get to chat with you and on such an important issue as this, and to go after Ed. I think it's such a privilege because all of the work that he's doing really is intertwined with product safety. So I'm excited to be here, and I'm excited to talk about this topic. So as you mentioned, I'm the Director of Consumer Product Safety at Consumer Federation of America, or CFA. So CFA is an association of nonprofit consumer groups that was established in 1968 to advance the consumer interest through research, advocacy, and education. In addition to product safety, we have experts in a whole host of other consumer protection areas like housing, financial services, food policy, all of those different types of things. And you can find us at consumerfed.org, on LinkedIn or X. And whether you're a policy-minded person or just a regular consumer, which we all are, I would encourage you to check out our work, because our lives are touching on so many of these important consumer protection areas.
Yeah, there's even if you feel like you know everything about safe sleep, and I don't think that anybody does, to go out and take advantage of what Consumer Federation of America has to offer beyond that, but especially what we're here to talk about with the infant products. And we are so glad to know that there is an agency like CFA on our side. We need more good guys, right? So tell us, we use lots of letters here. How does your organization work with the other organizations that we heard Bridget mention for consumer safety? Like you heard Bridget talk about meeting ASTM, JPMA standard, absence of CPC recalls, a lot of letters, but important ones, again, hopefully mostly on our side. So can you talk about how those agencies align, or maybe they don't, with the Consumer Federation of America?
Right. So when Devin and I were chatting about this, we were referring to this as the alphabet soup, because when you're thinking about product safety, there are all these organizations or federal agencies or international groups that have all of these various letters that mean different things. So to break it down a little bit to understand the landscape that we're dealing with, and the best way to prevent injuries and deaths from consumer products is that for there to be an effective safety standard. Now, many safety standards are voluntary, and that means that they are developed by stakeholders in the standard development process. And these standard development organizations are non-governmental groups that develop and publish voluntary standards. So for the purposes of today's conversation about safe sleep and infant products, the really important organization to be aware of is ASTM International. Now, membership to ASTM is open to anyone, and they have a number of subcommittees that are working to develop or improve safety standards on a variety of products, baby products, child's products, safe sleep products. And it is important that consumers participate in these subcommittees because we can provide real life experiences and interactions and expertise about how parents and caregivers are interacting with these products, how our children are interacting with this product. And if any of that resonates with anyone on this call, please reach out to me so that I can connect you with folks to participate on the standards development process. Moving on to the next heavy hitter in this world is CPSC, and that stands for Consumer Product Safety Commission. This is the only government agency on this slide, and they're a really important but tiny agency. They are an independent federal agency tasked with reducing the unreasonable risk of injuries and deaths associated with consumer products. And the number that they often use is that they oversee over 15,000 consumer product categories. So really an eye-watering number when you think about the number of products that they're tasked with identifying risks.
Wait, I'm sorry.
The
Did you say
wild thing is,
categories, not 15,000 products, but 15,000
right, exactly.
categories of products under there.
Right.
Okay, all
And
right.
it's a small agency. It has a pretty small footprint when we think about personnel and budget, and they're really asked to take on an enormous job because all of us are interacting with products every day, and all of us have an expectation that the products that we're bringing in our home or that we're interacting with or that our children are interacting with are safe. And if they're not safe, that we have some recourse to justice. So the CPSC is important because it includes professional staff that are technical experts in a variety of really important fields like chemistry, engineering, human factors, and they work to investigate issues, develop feasible mandatory standards, and they do participate in those voluntary standards that I was just talking about with ASTM International. Another thing that they work on that's really important to be aware of in the safe sleep context is that they also, under certain parameters, develop mandatory standards, which they can enforce, which means they can bring a little teeth to the fight. And then the other thing that they do that's really important within the safe sleep context is that they obtain recalls of dangerous products that they have identified as a hazard. And then finally, JPMA is the Juvenile Products Manufacturing Association. And so they're very active in this space, and they represent the manufacturers of juvenile products.
Yeah, and so it's an awful lot. I think we'll circle back maybe a little later and talk about the ASTM, but that's actually how Courtney and how I encountered Courtney actually through another Safe Sleep champion of ours, Michelle Berry. She said, "Do you know about what Courtney is doing?" And I said, "I don't know about what Courtney's doing." So it was great to connect that way, but that was through those ASTM and being on that infant product committee. And again, anybody can do that. It is voluntary. And as Courtney mentioned, having the consumers on there side by side, shoulder to shoulder with the manufacturers, who we have all very different goals, right? Unfortunately, we hope that the manufacturers have the same goals that we have in safety, but oftentimes there's a little bit of conflict there, and we'll talk about that in a bit.
Sometimes we have to remind them that
Right,
safety
right.
first, right? Yeah.
There are a couple foxes in that hen house. So please, if you're a consumer, come be a hen in that hen house with us. And
Yes.
so when you talk about the JPMA, the ASTM, and the CFA, and then the CPSC, with all of these agencies working to protect consumers, you really wouldn't think we would be faced with the recalls that the CPSC has to put out, or legislation to protect consumers that you would think these agencies, right? So as we were talking to prepare for this session today, I learned something new from you that I was surprised to learn. And it makes sense given what we see happening. But tell us about the pre-market approval process for new products. It might surprise everybody.
Right. So, I think a lot of consumers assume there must be something similar to how FDA approves new drugs, in the sense that there's some sort of pre-market approval, there's pre-market testing, there's something going on to ensure that the products that are making its way onto the marketplace and eventually into our homes and our children's rooms are safe. And that's just not true. There is no pre-market approval required for consumer products in this country, even for baby products. And there's no requirement that businesses do, specific things in order to ensure safety. Now, if there are, mandatory standards for the product. And again, those mandatory standards are enforced through the CPSC. But many standards, as I alluded to, are entirely voluntary, which means there is no way for the government to enforce compliance with these. Without the appropriate authority, the government is unable to ensure that the companies are enforcing these voluntary standards. So even when the federal government can enforce or has the authority to create a mandatory standard and then enforce it, by statute, they're really restrained in a sense that they have to defer to voluntary standards. And so in practical terms, this means, especially in the context of baby products, that we have to be extremely mindful of how we think about and how we discuss baby products with caregivers. Because again, we're all making the assumption that the products that we purchase, whether in a brick and mortar store or online, must be safe. And this is not necessarily true. And when we think about who is the most vulnerable population, infants, we need to make sure that we're always following the safe sleep guidelines developed by true experts with evidence-backed recommendations, and not just following whatever product is trending on social media, because it may not have ever been tested for safety.
Right. Crazy. So when you talk about, kind of that evolution of how the CPSC goes from, monitoring the product to voluntary standards, and then the recalls, and then enforcement, there is enforcement on the federal level, right? And that comes from another body. So let's talk about the most recently passed federal legislation, the Safe Sleep for Babies Act, how and why it came about, and what it covers.
Yeah, so this is a really important piece of legislation which was signed into law in 2022 by President Biden, and it prohibits the manufacture or sale of padded crib bumpers and infant inclined sleep products. So this law was passed after years and years of advocacy by parents, pediatricians, and consumer advocates. And unfortunately, in both those product categories, dozens of children have died. So let's think first about padded crib bumpers. We know that dozens of children have died in incidents associated with padded crib bumpers. And we know that crib bumper pads increase the likelihood of suffocation or entrapment. The CPSC, again, that federal agency I was referring to earlier, has received at least 113 reported fatalities that involved crib bumpers from 1990 through 2019. And so this was just such an important piece of legislation that gave the CPSC the authority to act on this particular product class. And then when we think about incline sleep products, these were incredibly popular 10 years ago. And what we know at this point is over 100 infants have died in infant sleep products. And the CPSC has been required to issue more than one version of the recall. And there are still these products on the marketplace, unfortunately, in a secondary kind of capacity, so on secondary marketplaces. And then recently in 2023, the CPSC voted to expand some protections from its 2022 infant sleep products rule. And so now the CPSC has additional enforcement tools from the Safe Sleep for Babies Act, and that helps the agency to ensure that these products aren't on the marketplace. Again, it's giving it a little bit more authority to act in an aggressive posture.
Yeah, sorry about I think that was my shock of the no to market thing still just surfacing when I talk. Sorry, excuse me, everybody. And so when you talk about the Safe Sleep for Babies Act and things like the bumper pads, nobody buys bumper pads because they think they're dangerous. We only make these purchases for our babies and our loved ones because we do love them. So, you know, knowing that we do have this federal legislation and that yes, they can say, do not manufacture and do not sell these products, it's unfortunate the time that it has to take, but very grateful to have the opportunity to share with everybody what that is and what to not buy anymore. So thank you for that. And then you see up there the Fisher Price Rock and Play. I mean, you talked about that there was a second recall on that. I think that that's the first time that the CPSC has had to do a round 2 of recalls on that, right?
Yeah, I mean, that's the only thing I can think, you know, recently. And do you want me to get in discussing that, Devin?
Well, sure, of course. I mean, in what if you want to talk about how that second recall worked.
Sure.
Yeah, go ahead.
Yeah. And so, you know, this is a particularly challenging situation to think about because it really illustrates all of the things that Devin and I have been talking about for the past couple of minutes. And that is the assumption, and a reasonable assumption, that consumers are making that the products available to them must be safe, because why would there be an unsafe product for an infant on a store shelf? It just boggles the mind. But in this particular case, this story about Fisher Price Rock and Play also underscores a couple of the barriers to safety that that consumers will face. And so this product was a cult product. Infants were dying on it. Unfortunately, the public was completely unaware, although the manufacturer and CPSC were aware of deaths associated with the product and that they could be attributed to use of the product. So meanwhile, none of us know about this. And so that begs the question, why wasn't the public informed in a more timely way that this was such a risk to some infants? And that's because the CPSC, again, that federal agency, is restrained from sharing critical safety information by a particular section of the Consumer Product Safety Act. And so Section 6B restricts the flow of information to consumers by requiring the CPSC to first go to manufacturers and before it can share information with the public. Before the CPSC can issue a recall, it must first go to the manufacturer and negotiate this recall. And the practical effect of this is that it really extends the time in which we are getting critical safety information. The way in which the public found out about the deaths associated with this product was completely by accident. There was an error on the side of the CPSC. Information was released to Consumer Reports. And from that, that organization was able to piece together the scale and scope of this problem. And it, you know, was able to, that by bringing that to light, consumer advocates were able, and especially parent advocates, were able to push for change in this particular case. But the problem with this particular product is you can still find it on secondary marketplaces. And that's why the CPSC continues to have to act in connection with this product. They have done another recall, And Chair Hong-Sark has also done letters to Meta, which is Facebook's parent company, because you can find these products on that particular platform still.
Yeah, and as you say, not only is it still on that platform, but people are still using it, gifting it to family members. I saw in a Facebook group someone asking what would happen if they did use it since it was recalled. They were going to give it to somebody, and they were actually asking if they would be criminally liable. So, why do you think, people won't give up a product like that once it's all those warnings?
I think that's such a good question, Devin. And when I think back to the period of my life when I had my first child, who was by any metric a bad sleeper, parents and caregivers, especially of infants, are very vulnerable, and it's can be kind of a desperate season of life where you're exhausted, you're scared, it's hard to find accurate information that you can trust, and it allows for manufacturers and sellers of these products to paint this fantasy that if you buy their product, this unsolvable problem will be solved, and your child will not wake you up every hour, and you will not be, feeding them all night. And unfortunately, that's just not true. We know that that's a fantasy. We know that there is a biological need for children to wake up through the night or eat or find comfort. And we also know that the safest sleep environment for infants is the absolute simplest. And so I think that these products become so popular because parents and caregivers are desperate for support, and manufacturers can take advantage of that feeling by suggesting that their product will solve that feeling or that particular problem for you.
And they can take that message to market because they don't have to do anything beforehand. So as you said, the simplest sleep, the safest is the simplest. So if it's not a crib, bassinet, or play yard, don't use it for sleep. Don't add anything to it, right? That's, we have some photos up here of what's safe and what's not safe. But, don't put any mattress toppers in it. Babies aren't uncomfortable. When you woke up right from a slumber party, say when you were 8, sleeping on the floor, you hopped right up. So imagine a baby, the same thing. They're not uncomfortable. They need to be safe. And there is no magic wand. It isn't forever, but it is a really, really rough few months. So really it is, how do we set expectations for families? How do we provide access to safe sleep education? And how do we be sure they know that if it's not a crib, bassinet, or play yard, that it's not for sleeping? And so what kind of work does the CPSC do for messages to the consumer like that?
Yeah. So CPSC is doing, its own consumer education in connection with safe sleep and other product areas. And then CFA, how we're working in the safe sleep space and how we're interacting with these ideas is we are participating in the standards development. We're sitting in on those subcommittees with you, Devin, and we're trying to make sure that we're developing strong safety standards that will keep children safe and that have safety in mind through the entire design process. The other thing that CFA does is we're working in coalition with several parent and consumer groups. You've mentioned Safe Infant Sleep, Michelle Berry, and there's several parent and consumer groups who are really tuned in on this issue and done product safety issues and are carefully paying attention. And so when we see issues, we bring them to CPSC. We participate in the rule making process through CPSC. And if CPSC doesn't have the authority or voluntary standards cannot make a product safe, then we do advocate for change in Congress to ensure that CPSC has the authority to keep our babies safe.
Yeah. And thank you for that work, right? Because there are, again, the good guys that are out there working to protect all of us. So we talked about the crib, bassinet, or play yard, the AAP's recommendation, and how this kind of evolved into the rock and play and the incline, and how we learned about that. And that brings me to another AAP recommendation for infant safe sleep and how that intersects with product safety. And that's the weighted wearable blanket, because the AAP says no weighted products. Don't put any weight on a baby that might prevent their full lung expansion or movement, but manufacturers continue to make them and retailers continue to sell them until very recently, though, there was some change. So can you share what's happening with the wearable blanket and itself and the weighted aspect of that?
Sure. So there's a couple of moving parts with this. When we think about the weighted component of a sleep sack, Consumer Product Safety Commission, the National Institutes of Health, and Centers for Disease Control and Prevention have all warned parents and consumers about the dangers related to the weighted portion of these sleep products and have deemed them unsafe. Following along with that, Senator Blumenthal has been a true leader in this space, and he has sent letters to the FTC regarding allegations of deceptive marketing claims related to the safety of these products. A really component here is that several of the nation's largest retailers have also pulled weighted infant sleepwear from their shelves and should be credited for that, because there were mounting concerns from parent and consumer groups about the products and that they were unsafe for babies. And these retailers took action when they really weren't required to. So we have to give credit where credit is due. And finally, there has been a bicameral introduction of Safeguarding Infants from Dangerous Sleep Act, and that would ban weighted sleep products like swaddle sleep sacks, blankets that obstruct movement and make it difficult for babies to breathe during unsupervised overnight sleep. And then finally, as I said, there's many moving parts. There is a subcommittee in ASTM that is actively working on sleep sacks. Now, that's not the weighted component, but there are other safety things that we need to be thinking about to ensure that all products that we're using on our babies are safe. And so we're working on that committee to make sure that any other safety concerns absent the weighted component are also being considered as manufacturers design and produce these products.
Yeah, like the neck hole size, the length,
Absolutely.
even being sure that the little zipper, if there is one, doesn't get hot. There are no manufacturing standards for wearable blankets now.
Right.
So that's again just kind of another example. This whole idea of the weighted blankets, to see the AAP and the experts make a recommendation, and then the retailers voluntarily do this, and then finally the legislation comes in to put that real teeth into it. So I think the message there is when it hits the legislation, it's for real. There's been a lot that goes behind that. So please know that it's reached a particular inflection point to lead to this, and so it is not without great research that went into that. So I do want to talk about some of the kind of things that are still happening, right? We have new legislation coming, or not new legislation, but new warnings regarding nursing pillows and infant support pillows, which are different, right? I didn't even realize that they were different. So I know we have a few minutes left to cover those if you have time.
Sure. So we'll start with the nursing pillows. And these are the nursing pillows are the products that you typically see for either nursing or bottle feeding an infant. And usually they're set around the adult to kind of support the weight of the child. In September, so last month, by a vote of 5-0, the CPSC did approve a new final rule that would address suffocation, entrapment, and fall risks that are associated with the use of nurse pillows. This is an important rule because CPSC is aware of at least 154 infant deaths and at least 64 injuries between 2010 and 2022 that were associated with nursing pillows. And most of those injuries and deaths were infants under the age of 3 months. And the majority of the deaths did occur in or on a sleep product. So the commission was finding that this particular product, while it should never be used in the context of sleep or in a sleep environment, that's the way in which it was being used. So CFA and other consumer advocates were supportive of this final rule because it provides the utility of a nursing pillow, right? Some caregivers feel that they need that, they want that, but it also improves the safety of the product. And then for baby loungers, CPSC has identified at least 79 reported fatalities that are associated with these cushions from 2010 to 2022, as well as 125 non-fatal incidents reports of the product during that same time period. And so in December last year, the CPSC issued a warning about a particular type of lounger that was violating a particular federal safety standard. And then this year, they issued a notice of proposed rulemaking, and the comment period for that ended in March. This is definitely a space to watch in the future, because again, it illustrates, the data from CPSC is illustrating that having any of these products within the context of an infant sleep environment is not safe.
Not safe. Yeah. So again, we kind of go back to the basics. If it has a strap, it's not for sleep. If it isn't flat, it's not for sleep. Particularly in this, this new, hack kind of environment too that are shared on TikTok. Look, if it's not for sleep, don't let baby sleep in it.
Right.
It's really, the simplest way to do it. Before we wrap up, we do want to let people know some resources that they have for resources for caregivers besides just the basic, flat, uncluttered environment, other places people can go for information on product safety.
Yeah, and I would just say that, there are experts that are providing evidence-based recommendations like CDC, CPSC, NIH, AAP. And I would encourage folks to sign up for emails from CPSC, monitor those at their website at saferproducts.gov to determine if there are known issues with this product that you're considering buying and bringing into your home and exposing children to. And then there are a number of incredible consumer and parent organizations that are working within this space and providing really high quality, safe sleep consumer education. So you have Kids in Danger up there. They just put out 2 excellent reports that I think every consumer should read, and provides really timely, critical information about recalls and some challenges there. I personally subscribe to their listserv, and I think it is so informative. And then some other incredible groups. You mentioned Safe Infant Sleep. They're currently working with the Claire Bear Foundation this month to provide short social media posts on safe sleep environments. And so seeking out those groups that are providing, again, the evidence-based recommendations that are, referring to a really credible source is just a wonderful resource to any caregiver or parent who is looking for more information within this area.
Right. Check it out before you buy. That's all.
Yes.
Don't add it to your cart until you check out this stuff, right?
Absolutely.
So I think we're going to wrap up. Courtney, as always, thank you. You're so generous with your time and expertise, from speaking at our conference in this past May, being on our program advisory board, and the time to join us today. Thank you so much for the work you're doing to keep us and our babies safe and
Thanks,
sound.
Devin.
And Courtney, like Ed, is going to hang on here for questions as we wrap up, because I told you we probably wouldn't have time, and we don't have time. So as we close the hour, if you've watched any of our webinars over 2023, we end the session with 3 things: a call to action, the date of our next webinar, and then we play our safe sleep lullaby, Just Baby. So first, the action item. There are lots to choose from this hour. I came up with 5, right? So you can pick one, pick them all, do all 5. Just do something though, right? We've already done something if you're watching this, so thank you. Join us on social media for the Clear the Crib Challenge throughout October by taking your videos and sharing ours. 2, you can use our new Safe or Not Safe education module. Complete it yourself, send it to colleagues, use it in an upcoming education session. 3, check out our partner catalog, remembering that purchase support our programs, especially with our expanded products and warehousing and distribution. 4, sign up for the product recall notices. That last slide was a great one that Andrea made for this presentation. And check out all of those other resources. And 5, maybe report the sale of unsafe products when you see those. You can see those when you go to the CPSC. They tell you what to do if you see something like that. So many options. No matter which ones you choose, we hope that you'll stay connected with us by following us on social media, again, which you see here. That's Where You're Alone, the mini cribette is available, and how to register for our next webinar, which is number 2 of our 3 at the end of things. There's a lot of numbers here. B, I should say. Our next quarterly webinar is scheduled for Thursday, January 9th, 2025 at noon Eastern. Save the date. Registration with topic information is released about a month in advance. Better yet, if you have something or someone you'd like to include in our quarterly webinars, including you, we welcome that feedback. So let us know. Send us an email to info@cribsforkids.org and say, hey, webinar content. So we appreciate that. So thank you. Finally, we're going to play our Safe Sleep Lullaby. As Just Baby plays, we're going to stay on to answer any questions in the Q&A. Remember, Just Baby is one more free resource Cribs for Kids offers. You can use the Safe Sleep Lullaby in meeting to open meetings or training, in your child care center at nap time, or over the speaker system in your L&D units in the evening. Lots of options again. A big thank you to Ed Guidry and Courtney Griffin for joining us as we launch the new quarterly edition of Cribs for Kids Safe Sleep Champion webinars. And as always, big thanks to Bridget for sitting alongside here. Appreciate the help and the support over there. It's good knowing somebody's here with you, right? And as always, thank you to those for joining us live and watching later. The time and commitment you share with us to reduce infant mortality by preventing sleep-related deaths is how we all make a difference. Thank you.
Bassinet or play our naps. No pillows, blankets, no toys. Just baby.